You can quite often tell when someone first walks in the room if they're well or unwell. Right. And you do start to develop a sense for that.
Why shouldn't I trust you to do what a doctor does?
It's the experience and sort of that sixth sense that we're talking about. I'm pretty certain that I want to be an A&E doctor.
Very reactive. Very anything could happen, probably less scheduled than any other doctor.
Yeah.
Are you prepared for what that's going to be like? And I'm guessing you're already in that environment now, right?
Well, I've never done A&E before.
No, never done A&E. So you would just be thrown into that when you get it.
Well, I've actually got a 3-week placement in A&E coming up.
Cool.
So that will be my sort of see if I hate this kind of thing.
Yeah.
But I've been on various different wards and medical specialties, and a lot of them, because they're quite focused, you end up seeing the same conditions
right, okay,
on a day in day out basis, and I just want the variety. I don't want to be bored. I hate being bored. And you probably wouldn't be that bored, but you couldn't be bored in A&E.
Yeah, no, for sure. But if you got the same 5 cases of like lung disease, I'm like, can we get some variation?
Yeah.
You know. But within that, though, say if you were dealing with the same conditions or diseases, there are intricacies and things you can learn from different patients, surely. So for you probably even see that as fascinating, right?
Yeah, we do say you can quite often tell when someone first walks in the room if they're well or unwell.
Right.
And you do start to develop a sense for that. And I feel like I'm starting to.
Wow.
When you go to approach a patient and you're like, okay, this is a sick person.
Yeah. And not like cool, like these guys are unwell. Yeah.
Yeah.
Oh, this guy's fucking cool. But yeah.
Fucking sick.
Have you talked to him? He's amazing. We should have a drink when you get out, mate. We should have... No. But yeah, so you've been shadowing these people. Is there anything else, like, you would always have to visit them? So you're going up to the bed, you're asking them these questions. How would you say, like, what's a doctor better than you at right now? Obviously the training, the experience, but like to a simpleton, like, why shouldn't I trust you to do what a doctor does?
That's a good question. I think it's mostly just my knowledge is obviously much less than that of a qualified doctor because I've got 2 years left.
Right. Yeah.
But it's the experience and sort of that sixth sense that we're talking about. And so if someone comes to you with a certain symptom, I know what questions to ask, but they might pick up on certain details that I might miss, or their interaction will be smoother.
Yeah.
Or they'll sort of just more quickly tune into something that the patient said, I feel like.
Yeah, and maybe one way you could do that is you could maybe have a little app where after you're done with the interaction, could you rate me on my boxing skills? You know, give me 5 stars. You know, like when you get out.
Very NHS.
Yeah, maybe not NHS. Maybe do that in the private field. But whenever I get out of an Uber, they go, rate me 5 stars. And sometimes that makes me not want to rate them 5 stars. They're begging it for it a little bit. So maybe that's not a good idea. But that could be one way of the ranking. And is there like any competitive environment? Like, what is the culture in like that? You know, you got your fellow medicine students you're working with, and like any certain power dynamics. Like, it all seems very relaxed as a patient. Like, how is it?
That's what we want you to think.
Yeah. It's all an illusion.
Yeah. The dynamic's strange, and it's developing at the moment, and it's changing at the moment, I would say. Because there's always, medicine is, you know, quite an old and traditional practice, I guess.
Right.
People have been studying it for ages, and there's been doctors around for ages. And there are certain sort of ways of acting that hang over from that, which is that the doctor is always right and they're the boss, basically.
Okay, yeah.
Whereas now we're moving towards an approach of we listen to the patient knows what's best for them, and we take into account them as a person and then their medical stuff as well, obviously.
Right.
But really use that to help them in the best possible way.
Wow. Okay. So it's less like objectively medical, but you now in modern age, like take into account their living situation, like how they are as a personality.
Yeah.
Wow. Why do you think that it's gone down that kind of route? Just because we are becoming more empathetic and maybe more care? Why is that? You don't. If there might not be that might not be an easy question.
Well, there certainly have been studies, but I can't quote them. But I think just it's been found that people get better quicker if you take into account their social situation and their personal situation as well, and treat them holistically and not just as a disease.
Yeah, damn, that's really interesting. I didn't even think that. So maybe I'm getting a little bit of a different treatment to Suzanne, who sat next to me. Maybe they even speak to me a little bit more different. They'll probably use like cool hip words with me because I'm quite cool.
This guy's cool. So.
Yeah. Damn. You ever like have like a genuine like good chat with? I know you probably have good chats with him, but you're like, wow, this guy. I could talk to this guy. Like, obviously you wouldn't because that's unprofessional, but I feel like a lot of people who come into contact with like disease and stuff, I don't know, whenever I've been in a hospital, I've always like found brightness out of such like a dark situation. I don't know. I feel like there's so many like sweet and just like wholesome moments you see in hospitals. Like, is there any like things you can remember or anything you're allowed to speak about? Because I feel like, yeah.
Let me think.
That's all good. Do you get what I mean? Because like, hospitals, everyone's in it together, especially the patients. No one really wants to be there, but I feel like you cherish the little things more when you're on that bed. You know, you've been there for a couple of weeks.
Well, you do when patients thank you and thank the doctors and nurses and all the staff that are treating them. That it's unfortunately rare,
Really?
And that is amazing when that happens. When someone's like, I really appreciate what you've done for me. That's really nice. When patients get discharged, I get really, it's just really nice, especially if they've been in hospital for a while. My most recent placement was on the renal ward, which is kidneys. And those patients are usually really quite ill because, well, they are. And they've got lots of different things going on with them. And they can end up stuck in hospital for a really long time. So you start seeing them. I have 5-week placements at the moment, and some of the patients would have been there for the whole time. And seeing them get to go home, because you feel like you've been there and for part of their journey, and you start to just really hope for the best for them, I guess. Yeah. So that's probably the best feeling.
That is, yeah. You probably wouldn't think, or I'm trying to remember if I thank them now. God.